when we were passing the FIF Act. And for that reason, we had invited the fund accounts manager, which I believe is here. The FIF, yes, thank you. Thank you so much. I think those are some of the very key people that we wanted to be here as we implement the Act. I think before we go to the specifics, I just want to give the Chief Officer for Health an opportunity
the reconciliations are done today so that they confirm
in your absence, and we'll report back to you. I think the Vice Chair has something that he wants just to add on to what you've just mentioned before we proceed.
Thank you. Mine is just to the fund manager, because you mentioned something on facility improvement system failure. I don't know, I'm just trying to have this wild thought. I don't know whether you don't have a backup as the fund manager for these records, because if you say that at the facilities, we have the in charges doing the
That we let them know. And then they accumulate it. And we give them AIE by 15th of the first month of the next quarter. That is what we usually do.
Thank you again. I think we can make the systems better. All the facilities have a bank account. This money can be going to a bank account. That can happen. I don't know why it didn't happen, but that can happen.
You're suggesting that this money goes straight to the bank account?
Yes.
I think that cannot happen. And that's why you made this app, because you cannot spend at all. If you turn off your microphone so that I agree with that, we cannot spend at all. Thank you.
Maybe from the FIF part. At source, but what we'll be doing is the money will be going to our various accounts, and then when we have a budget, we can now spend it.
That is still considered spending at source. That's why we created a fund. You cannot spend money before passing through CRF or a fund created by this assembly. That is what the act say. Any other account that you're having, that is, it's like collecting that money in your pocket and spending it. So that one is not allowed by a national act. The question is, do we task finance department to move from giving you money monthly to give you quarterly to giving money monthly? Yes, Moseti.
Thank you, Chair. I'll agree with the Chief Officer of Health that quarterly is usually prudent because it gives us time also to at least budget and do all the paperwork that are needed. Thank you.
Anybody with contrary opinion? Contrary to the quarterly one? Yes.
Thank you, Chair. The AIs, we ask for them quarterly, which is just been working okay for us. Problem is budgeting when you don't have the money in the account. You always put the in-charges in a very bad situation with the other members of the management team. So we are requesting if by the time we are budgeting, that is, we do our budgets within the first week of the new quarter, that is before 15th. So if by then we have the money in the account, it makes it easy for us to do budgeting and be very transparent with the rest of the team on how we are going to allocate funds and how we are going to run the hospital. Thank you.
Thank you. So we are all agreeing that even though finance department wanted to move the disbursement of funds from quarterly to monthly, the in-charges prefer that money be distributed quarterly. Is that what we are saying? As many as the opinion say aye, as many as the contrary opinion say nay. The ayes have it finance. So the in-charges are requesting that even though you are planning to give the money monthly, please continue giving the money quarterly, but just make it very fast and efficient. So every quarter, and so you can plan on that whole system that by the beginning of the quarter, they have monies to spend. Yes, Deputy Speaker, you want to say something?
Thank you, Chair. We appreciate that the FIF is trying to sort out our messes at the facilities. But Chair, I know this is a little off the cuffs, yeah? What I want to say is a little off the cuff. I know facilities are still ailing with pending bills. So I just wanted the finance department to make us understand how they are going to sort out the messes, because when we visited like Paponditi, they have pending bills ranging from 2011. The same is with Sondu and other facilities. So as much as we have FIF, how is the finance department going to help facilities sort out their pending bills? And as an assembly, budget for the pending bills in the last financial year and in this financial year, do these pending bills at the facilities form part of the pending bills that we budgeted for? And if yes, how soon is your department going to sort them out? Thank you.
I think just keep that. Chief Officer Finance, just keep that. Chief Officer Health, just keep that issue of pending bill, so that we address this issue of FIF, then we finish with that. I think it's the most interesting one that we found in these facilities. Yes, proceed, fund account.
Thank you, Honorable Chair. I think have effectively and efficiently responded to the issues raised by this honorable committee, unless there is a clarification that is needed from me.
Maybe just one. Password change. I think we went to Paponditi. There was transfer of the former MedSoup and there was a new one, and then the administrators. How long does it take to have that password change, especially for the pay bills, so that the in-charges can know? How long should it take?
Thank you, Chair. We have been working with, as a team, and there's a colleague of mine that was mandated to oversee that, and actually by yesterday, he had ensured that the issues of password change has been really worked on, and Paponditi, they are now able to view. And I think one of them, the administrator of the pay bill, is now mandated to actually do the password change. It is, I know it was a very difficult task, getting those who had been transferred to other facilities and now having the new people, but Chair, that one has been done. And I think also Director Revenue can add something on that.
Yes, before I give the Vice Chair, I know it has been done. I just want to know the timeline. I want these in charges to live here knowing the timeline, because I know Chief Officer is planning to do another reshuffle next year. And that one is coming to, I don't know, KCRH, and then Vane is now going to wherever. How long will it take for that change? But let me get from Vice Chair.
Okay. Yeah, thank you. I'll just make I'll make a comment on the delays. You know, as we are visiting these facilities, there's a very big challenge on the staffing. And remember, the moment we lose revenue due to these delays, then we are not able to work around the wage bill of the county. So, you know, if we talk about delays coming up because of transfers, it means someone is not doing his part somewhere that is supposed to do, because I don't think it's a short while since the in charge of for Paponditi was put there. I don't think it's been a while. I don't know how long it is. It's taken. But you know, so long the moment we have such a huge gap in the collection of revenue, then you know we're losing a lot. Maybe that's just one case that we came across. But what about the other cases? Yeah, so maybe the fund manager, maybe you can just clarify on what plans you have for the future for this, and also how you handle the other cases.
Thank you, Deputy Chair. Let me clarify this, and Director Kungu will respond on the delay and the timelines as far as change of password is concerned from Safaricom. But the change of passwords does not affect the daily revenue of the revenue collection. What it affects is that the in-charges may not be able to actually verify or do the reconciliation with the M-Pesa statements, but we still expect them to have the manual reconciliation, the manual collection book, and those who are using the hospital management system, they also have what's called funds of report. They can generate the funds of report at the end of each and every day and compare the funds of report and the manual collection book and do the revenue reconciliation. And when they are declaring the revenue or surrendering the revenue, before 5th of each and every month, actually, those are the various documents that they're supposed to use. So the change of password may delay viewing of the M-Pesa or pay bill statements, but may not delay collection of the revenue.
So without so many words, how long does it take to change the password? I don't know what it's called. So that these in charges know. Wasije wakatupigia kelele tena, unajua password hatujapata. Let me get from the Director of Revenue, then Chief Officer.
Chair, I would really wish to hear this complaint from the source, from the men. What is it that really challenged this is? What is it?
This complaint came from Paponditi. I think the MedSoup was transferred, I think, to JOTRH. There was a new MedSoup, and then there was a new admin. And then the money that was given to Paponditi was less than the money that they felt that they had collected. On questioning, they were told to confirm with the password M-Pesa statements, but they could not get the M-Pesa statements because they did not have the password. That's how the complaint started. So we are just trying to avoid future complaints, especially on reconciliation of the monies collected by the facility and the Directorate of Revenue.
Chair, as your Deputy Chair is saying, as far as I can remember, Dr. Elron has been in Papunditi for as long as a very long time ago. So let's hear this from him also.
Yes, Dr. Edon.
Thank you, Chair, and our Chief. I think the issue arose because of the difference in collection, because we were relying on the manual entry of M-Pesa transactions. So when we get our statement from the revenue team, it was always short of what we have manually. So this we could not verify because we could not be able to see our statement. The reason why we could not be able to see our statement because the former administrator of the M-Pesa statement, of the M-Pesa who could view the statement was transferred, and it was not able to give us the password. Because I think also when he got transferred, he could not even remember the password. So it was a bit a challenge. We were going through it with the accountant until last week on Friday, when it was sorted now. He gave us the M-Pesa, the passwords, the in charge and the admin. Now we can able to view statement, and we're even going back to the previous months where we had challenges. We rely on two things: the manual, the M-Pesa statement, and the what we call the FundSoft report, which is a software we use. Sometimes with the FundSoft, you see the amount maybe is 400, and the M-Pesa statement is 250, but I realize there's a lot of duplication. Now it's being entered manually by somebody, so there's a lot of duplication. So they level at par. There will be a difference maybe of 20,000, 30,000. So with viewing of M-Pesa, which is this true statement, I think now we are able to know where we are. I think this was a challenge for many hospitals. I think only Combea was viewing its statements promptly. It's not only Paponditi problem. So I think the accountants attached this hospital, they have worked hard. So now I think most hospitals, if not all, are able to view their statements. So I think that's where the problem arose.
Thank you, Dr. Now you've heard. Now, I don't know if you still want to comment or I give it straight to Director Kungu.
It's given to the administrator and the MedSoup.
So you've been the MedSoup?
Yeah, it was with the previous MedSoup. So for us to change, you have to change it. So it has gone through a process.
For how long have you been a MedSoup in Nyakachi?
Since end of last year.
Chief Officer, now you understand why we are concerned, because he's been a MedSoup since end of last year, and I think until that's like 10 months or so.
Yeah.
So 10 months he could not access the password.
That's
And that's why I'm asking the Department of Finance, how long does it take to change the password? So that we don't have those issues of 8 months where people cannot get their statements and verify and confirm the actual collections. We need to agree here. How long does it take? Yes, Director.
Thank you, Chair. As it is with all new things, there are what we call teething problems when anything new starts. When we started the FIF program, when we began this program, I was the focal point in terms of creating the pay bills and basically administering to Safaricom details of the med soups for purposes of password. But Health and I realized that was unnecessary bureaucracy. And that's why the fund manager says that they have now a new focal person who deals with issues of creation of passwords through Safaricom. Now, that is a plus if you ask me. When we go now to the time it takes to create a password, as long as you give Safaricom the details that they require, it takes less than 24 hours. But when a MedSoup, and Chair, this is something that has happened, it gives Safaricom an Airtel line to be facilitated, certainly that will not happen. And that will take a very long time. So for as long as the details required are given as expected, it will take less than 24 hours.
Thank you, Director. So we are agreeing that it will take less than 22 hours as long as you give your details plus Safaricom line. I think maybe they didn't know that. So please, through your directorate, let's not have this issue of 8 months before a facility gets just a password to see their statements and confirm their collection. I think that's something that you can do without even asking any other person. Thank you. Before we go to the last thing, which was the pending bills, which was all over the facilities, maybe there's one question that we did not respond to very well. When we were at Sondu told us in the last financial year they only got money for 1 quarter. Where's the in charge of Sondu? Yes, Odero, help us understand today.
What was we discussed when we have a meeting, it was about the recurrent, which was bringing in the pending bills for the cash vault. It's not FIF. FIF, we just get our money timely.
It comes to the monies that we get from the recurrents. Yeah. You only got for 1 quarter. Yes. Then the rest of the months you didn't get anything.
Yes.
We'll comment on that. Kidogo too, but maybe I don't know. Maybe I give now Chief Officer is very new. Yes, Dr. Lucy.
Let me, Chair. First of all, I must say I'm very excited about this discussion because a lot of things are coming out that is going to make this thing work even better. I want to say this, that apart from the FIF Chair and honorable members, in this, I think 2 or so last quarters, we have been giving these facilities money from our CRF based on the workload. To the extent that I think in the last quarter, if there's any facility here that probably did not get any money and it's not Masogo, which had a technical issue, can we have that facility be identified now if they did not get their CRF money transferred to their accounts?
In charges, the Chief Officer Health is saying that if you didn't get monies in the last financial year, the last quarter of the financial year, I want to make it specific to the Sondu one. Sondu said in the last financial year they only got money once instead of 4 times. Is it 3 times or 4 times? 4 times, yeah. So hizo zingine tatu zilipotea mahali. So chief officer is saying, please, if you didn't get money in the last quarter, let him know immediately so that he can take action. So this should go to all the in charges, not only the ones who are here for FIF. I think that communication should go to, you need to communicate with all the dispensaries too, because I don't think they are here, so that we can help facilitate their provision of services. Thank you. I wish Waziri was here, but he's not here, so I want to send you to the Waziri for Health, Dr. Ganda. We have agreed here that we are going to give facilities money every quarter. I told you it's not in the act, but we can put it in the regulations. So he needs to review the regulations. If it's not there, then we need to put it in those regulations that all these facilities will be getting money every quarter, so that it's not at the whims of the department on when to give, but it's in the regulation that supports the act. That's okay? As people who have been implementing the FIF Act, any other aspect of the act that you feel we need to change as an assembly? Ama iko tu mzuri tu vile iko? But if you think of it, maybe later than this, please feel free to communicate with our clerk so that we know aspects of the act that we can change to make it even much more better. Lastly, I want to go into the pending bills. And finance, I want you to pay close attention. Every budget and appropriation we do in this house, we pass close to 1 billion for pending bills. When we travel to these facilities, they tell us they have pending bills, which, adds into lots of millions. Our question has been, the pending bill is handled by your department. Why are you not considering these facilities while handling pending bill? And yet we appropriate monies for pending bills in this house for your department to pay those. Could you please get your comment?
Okay, thank you, Chair. My comment is that with the money has been appropriated for pending bill by the County Assembly. Even this financial year, we have 1.3 billion that is supposed to be going to the pending bill that is domiciled in finance. This 1.3 that is domiciled in finance is pending bill for the development expenditure. The rest that are recurrent in nature, they are normally taken back to the department for them to prioritize them for the current year, for their current year expenditure. So from where I sit, what I can tell you is that for the development pending bills, we have a long list of many pending bills. Even today, as I speak, I've left the Director for Finance or Account Services trying to consolidate them and coming up with a proper payment plan that is going to be shared across the department and across all the other actors, players, stakeholders in the pending bill. So for the recurrent spending bill, I think my prayer to you, Chair, is that if we can come up with we can consolidate all the recurrent pending bill. Actually, from where I sit, I may not have them, and that's why when this question was raised by the Honorable Deputy Speaker, I was consulting with him, and he was going to the mic, because maybe there's something that we need to consult with the department for us to be able to resolve all the pending bills, because after all of them are affecting the Kisumu County citizens.
Yeah, so from your explanation, are you insinuating that all the pending bills in this facility are recurrent? Chief Officer, are all their pending bills recurrent? Or nobody knows that report?
Chair and honorable members, before I answer that, allow me to say something.
Proceed.
If you study the pending bills that we have in the facilities, these pending bills were incurred during the period when we had UHC. when facilities were promised that they would be given funds from the government. And therefore, there was no FIF, no facility was collecting any funds. And a patient would walk in to facility, get surgery done, and would walk away in the hope that the facilities would be reimbursed. This did not happen. And if you study the trend, in the last, since we started this FIF, and also giving the facilities recurrent reimbursements, these pending bills have reduced drastically. And the other thing I need to say, which I have told my MedSups, that please don't commit government to things you know we will not fund. Because finally we will go into your salaries. If you have a rogue MedSup who, for one reason or the other, has decided to order 400 kilograms of beans, the store can only carry 5. Right? And he has 10 patients. So you see, there's a bit of disparity here. So even as we discuss pending bills, Chair, we need to interrogate them thoroughly to the extent that we only commit government to what we can pay. I have told my MedSups that if you commit government to embarrassment, we will not be very kind with moving forward.
Thank you so much, Chief Officer. I think I like your submission. We are agreeing that pending bill is hindering service provision in all our facilities, but we are again requesting that the in-charges do not put the government into debts that they know we can avoid. So for now, for the pending bills that we are having, let them submit to you all their pending bills, and then they can be interrogated, as you are saying, and then we agree which ones are legible pending bills. I think there's something like that in finance. Then we can now work on how to pay these legible pending bills, whether we allow them to pay some from their own collections and then we cut a sum from the budget so that we finish paying them, and then they can use the monies that they collect for the current expenditures that they need for service provision. I think let's work on that so that we don't visit these facilities and they tell us about casuals have not been paid for 8 months. I don't know, they were given maize and they could not pay, and now that person is coming to the facility. We need to move away from that. So I think we might work on it with the in-charges. They give you the pending bills, you interrogate, then we get a report as an assembly, and then we can help you plan on how we can pay them with the department. I think we can load some on them. What are they doing with 1.3 billion if not paying the pending bills that are eligible like this one we are going to get? How long can that take? About the pending bills of these facilities? In charges, how long can you take to submit your eligible pending bills to Chief Officer? Somebody saying 1 day here. Or 1 week. Anybody with contrary opinion? So in 1 week's time, please, let's submit all our pending bills to our Chief Officer. And then I don't know how long it will take you to interrogate them.
Chair, I also want to put a rider to that. If you know any of them are questionable, don't try us. Because we will come for you.
Don't tempt us. Because we want to see the best out of this. Then I think once you've submitted and he has told you, please don't try him with what you know is not legible. And Chief Officer, how long will it take you to now verify? Then we can now call a meeting with the department to let us know how we can solve the issue of pending bills.
Mr. Sewe?
Chair, that one we can, within a week, once they are, we all have them as we have started getting them. Actually, Chair, we have started getting them. We are collecting them right now. Yeah. So what I will do is just now to present them to the Chief Officer. We go through them together as a committee. Then we see the ones that are eligible for payment. be put aside, and the ones that cannot, like the way Chief is saying, the ones that we are being tried with, those ones we shall put in the shelves. 1 week is enough.
So we are giving ourselves 2 weeks. 2 weeks we shall have. Could you please turn off your microphone? Yes, so we are giving ourselves 2 weeks to finish with the issue of pending bills at departmental level. Then we can invite ourselves here, Assembly, Department of Finance, and Department of Health. And then we can make a plan on how to help these facilities pay those pending bills, so that all of them know. If it's their responsibility, they need to know it's their responsibility. If you can assist them, they need to know we are going to assist you up to this much or with everything, so that they get prepared. That's okay with everyone? As many as of the opinion say aye, the ayes have it. I think we have finished the concerns we are having on FIF, which was the major thing. We've added on to the pending bills, which is an emerging thing. I think I'll allow anyone now to make a comment before I go to the honorable members from the executive side. Anybody on the comment about, before I give the two chief officers? Yes.
Most of the facility in charges here are either medical officers or medical doctors who may not have very deep understanding of some of the accounting details. So as the in charges, we are requesting the revenue department or the accountants to be facilitative to the in charges, so that we sort out these problems that may arise in the FIF Act implementation. Thank you.
Thank you so much. I think, yes. In charge of Rabur, right?
Thank you, Chair. I also want to echo to the members that the FIF actually has really changed the way we've been offering our services in the facilities. Yeah? And so, again, as the facility managers, we are made to have, the business mind. And therefore, for us to generate a lot of revenue, then from the county assembly and through the committee, I think we need to channel resources so that even the revenue collection in our facilities, all the facilities actually, for the facilities who are collecting funds, can be automated. That will improve our revenue generation. Otherwise, thank you so much.
Automation, we've heard about automation, facilitation of the in charges for revenue collection. Any other comment? No more comment. I will go to the chief officers. I'll start with the chief officer for finance. Paul.
Thank you, Chair. Thank you. That first I forgot to say this is my first submission ever since I was vetted by this house. So let me first of all say thank you for you approving my name for appointment as a chief officer of finance. Now being the case, I am so excited to have sat in this committee to understand the working of the FIF. Actually, I would say that I'm still new, but I'm still trying to learn how it is working. But one of the things that I found when I went to the Act is that I'm not even a committee member in the FIF. So the chief officer of finance name is highly excluded in the FIF. So maybe you can, when you are reviewing or when you are doing the regulation, I think I believe that the chief officer finance position is supposed to be part of the board of the committee member. Then on the other hand, on the issue of the pending bill, I like the way we have it has come out here. It's an issue that we are also grappling with on how to deal with the recurrent pending bills, because we have realized that as a department we are dealing with the development pending bills, which on the verification is a must. Before paying them, they must go back to the department for them to authenticate them, that to see whether they are valid or whether they are the one who incurred them before they can come for payment. Basically, the issue of the revenue collection cannot be underrated, because we realize that if we don't meet the revenue target, the pending bills will still continue accruing, which is an issue that I have found that we should try to come up and interrogate. And I like the way you have ruled it, that once we have the departments have submitted their recurrent pending bill from the facilities, we come here with finance, look at our budget, and look at the realistic target that we have set in our budget, and see whether it is possible for us to meet this all the pending bills that the county government has. Because actually it is giving us a bad name. The contractors are not feeling like working with us again. On the automation, as I had stated in my introductory submissions, we are in the process of automating the revenue collection, total automation. And today, maybe, I don't know, today, I think at this hour, the opening of the tenders is ongoing, and we are expecting to have a revenue system in place by the end of September this year. Yes, thank you, Chair, for listening to me.
Thank you, Chief Officer. Yes, Dr. Lucy.
Thank you, Chair, and thank you, honorable members of this assembly, for the time you've spent together to make FIF work better. I will say this. My officers in the field are doing a fantastic job in very difficult circumstances. A lot of times, they have to prioritize what to buy and what not to buy. A lot of times, they have serious deficits on the budgets, but facilities are functioning. We visit these facilities impromptu a lot of times, but we also have prescribed supervisory visits to these facilities. Honorable Chair and members, you walk into some facilities, you find very encouraging things. You walk into Gita today, patients that have given birth are being given food 5 times in a day. They take their breakfast, 10 o'clock there's something for them, lunch they take, 4 o'clock they take, and the evening they have some supper. Rabur is doing the same, and a lot of these facilities are doing the same. I was in a facility just last week, and of all the medicines that this facility requires, only one was missing. One. And for us, that is a plus. I walked into a facility the other day, and I found out that all casuals have been paid their dues except for August, and there was enough money to pay August and September in the bank. So, you know, Chair and honorable members, we are one department that people only talk about us when bad things happen, you know. But we are trying to accept it the way it is, because we deal with the lives. People can be emotive when bad things happen in facilities. But I want to assure you, because you're the representatives of the people of Kisumu County, Chair, that the team I have here, managing the Department of Health, is a fantastic team. We may have 1 or 2, but we are nyoroshing them kidogo. Tunanyoroshana tu, kipole pole tu, and not in a punitive manner, but in a manner that makes sure that the right things are done. What we want to ask from the Assembly is what we have gotten already, support. Chair, you are aware that I've been around for some time with health management in this country and this province and this country as a whole. But I want to say this, not because you're here. You're one assembly that has been extremely supportive of our activities. Never ever did I see members of the assembly walking into facilities to find out what is going on and then report to us and call us to come and explain ourselves out. I am sure, I am certain, Chair and members of the assembly, that even from the answers we have heard from my members here, from my executive and facility in charges, that you are happy. Though, you know, you are leaders, you may not tell us very good, but we know we are doing very well, and we know you are happy, except for a few things that we will do. We want to ask that this relationship must continue. If there are issues, please call us up. We will come and not give excuses. Where we have not done very well, we will say here, we have not done very well. Where we think we have been accused of things that we have not done, we will explain to you. And where we think things are good, we'll say, okay, we are very good. The Department of Finance has been very supportive of the Department of Health, and Paul and team, Mr. Kungu. Thank you so much for the support that we received. Sometimes when the funds are dwindling, we are the only department that they look at with good eyes. These people may not know, but at my level, at the level of Paul and Mr. Kungu, we relate at a personal level. And the Department of Health is a priority to the Department of Finance. So generally, Chair, honorable members, I've said what I need to say. Thank you so much for what you have been to us and what you continue to be to us. We'll appreciate you, and I promise that we will not let the people of Kisumu down. And we want to ask that if there are any issues to be raised, please do so anytime. Thank you, and may God bless all of us.
Thank you so much, Chief Officer. I want to give it to the honorable members on the Health Committee, but I want to welcome three members who have come to join us. The Honorable Peter Basso, nominated, the member for Awasi Onjeko, Honorable Ngeta Maurice, and the honorable member for North Kisumu, the Honorable Samuel Dede. We're just finishing the meeting, and I want to give the honorable members for Health an opportunity to also give their last comments before I finish. Yes, Honorable Deputy Speaker.
Thank you, Chair. Chair, I think I'm satisfied with the discussion and the responses coming from our in charges and our chiefs. We are looking forward to more we are looking forward to better facilities and better services to our people. But Chair, I know there are other issues apart from FIF challenges and pending bills giving us some little problems. And now that the chief is here, Chair, you remember we went to Paponditi and we had issues with the title deed. We went, there's the issue of KDH. Chair.
Honorable member.
Yes.
I will request you to just take to the agenda of today. We are coming to that later once we are done with the reports of all those facilities. We'll invite them and we'll give them a copy of the report on our tour on those facilities for the action. So just hold your horses. Thank you.
Thank you for the guidance, Chair. But we have faith that the chief officers and all the in charges have the interests of our people at heart. We as an assembly are still committed to help where we can to ensure that the residents of Kisumu County get the best services that they deserve. Otherwise, Chair, I'm humbled that the entire team actually came in time and honored our invite to share what we had to share with them. Thank you.
Thank you. Yes, Honorable Karen, any comment?
Thank you, Chair. I want to take this opportunity to thank chief officers and their team for the cooperation. We always get you when we need you. Just keep up. Thank you.
Yes, the Vice Chair.
Yeah, mine is just to appreciate you for creating time to come and be with us. I know it's a journey that we're working together, and whenever you see us at your facilities, we've come to make healthcare in Kisumu County better. One thing that I'm learning, I know I'm new in this hospital management and all this, but one thing I'm learning is that FIF is actually a very good tool. It's a very good act that Kisumu County adopted, and I'm happy it made the in charges of the facilities also responsible. I know as we take our journeys to these facilities, I can actually rate. We can actually rate from the few facilities we've gone to. I know the facilities who are actually doing a good job, and there are some that did a lot of improvement. And I'd just like to encourage you to continue doing the good job that you're doing. I know with the able leadership of your chief officer and the CCM of health, I know the capacity. I know we are going to take Kisumu healthcare at a different level. Otherwise, I'd like to appreciate you, and anytime we meet, know that we are there to make healthcare in Kisumu County better. Thank you.
Thank you, Vice Chair. The in charge of Moroni and Nyangoma. Please, if you are here, see the committee clerk. I think there's communication she wants to make with you. The in charge of Ahero and Nyangande. Ahero and Nyangande, God willing, we will visit you tomorrow so that we can share some of the challenges that you're having as a facility. Please don't take this opportunity to go and make things so perfect when you know you can't sustain that. Just let things the way they are. We also see them, and then we can plan as a team on how to make them better. Let me join Chief Officer on commending the work done at Gate and Rabur. We also visited those facilities, and I think you can take other facilities for benchmarking to those facilities so that they can also improve. But they told me they went to Nakuru for something. They went to Nakuru for something that has made them the way they are. Now I think these other facilities can go to Geta so that they become like what they saw in Nakuru without necessarily going back to Nakuru again. Thank you so much, Geta. I want you to help facilitate Sondu. We went there and they couldn't even have money to slash the compound. Slashing too. Ile mgonjwa akiingia bwana sikanyage nyoka. Slashing. So help Odero do the slashing. Odero, ulipewa pesa ya kuslash? Nimewaambia wakupee pesa ya kuslash bwana. Usiwache facility kuwe buchi hivyo. And any other facility that's not appealing, we know ourselves. You know, sometimes when you enter into a facility and you just see the arrangement and the plan of things and you start getting healed before you even see the in charge or the doctors or the nurse. So let's also practice that in our facilities. Otherwise, we called ourselves here as friends whose intention is to improve services to our people. We are working for the same people, and that's the people of Kisumu, and that's why we are here. We are not here to fall find. We are not here to see the bad that you are seeing. We are all here to improve on what we are already doing. And I believe we will continue doing this so that we become better and better and better. So chief officers, every time we call you, please don't have pressure that we are coming here to crucify you. We are coming here to report to you what we have seen, and then we find a solution as a team so that we make them better and better. Otherwise, thank you so much, and we want to really appreciate that you honored this invite. And we believe from this meeting, we are going to have several changes that will make service provision even easier. As the acting chair of today, I will close with a word of prayer.